Welcome, everyone, to a crucial discussion that directly impacts the health and well-being of our senior population. In the pursuit of maintaining vitality and addressing age-related concerns, many older adults turn to dietary supplements, often with the best intentions. We're bombarded with messages about the benefits of various vitamins and minerals, and it's easy to assume that if a little is good, more must be better. However, when it comes to supplementation, this can be a dangerous misconception, particularly for seniors whose bodies process nutrients differently and who may have underlying health conditions or be on multiple medications. Today, we're going to pull back the curtain on two commonly supplemented nutrients, vitamin E and calcium, and reveal why, despite their essential roles, excessive or inappropriate supplementation can actually harm seniors, leading to issues like muscle weakness, impaired circulation, and increased risks of serious health complications. This isn't about demonizing these vital nutrients, but rather empowering you with knowledge. We'll delve into the science behind why high doses, especially of synthetic forms, can become detrimental, and what you need to know to make informed decisions for yourself or your loved ones. Understanding these risks is key to truly supporting healthy aging and ensuring that the supplements taken are genuinely beneficial, not inadvertently harmful. Let's explore why sometimes less is indeed more, and why a balanced approach is always the safest path. 1. Vitamin E, high dose or synthetic form. Vitamin E is an essential fat-soluble vitamin renowned for its powerful antioxidant properties. It acts as a shield, protecting our cells from damage caused by free radicals, which are unstable molecules that contribute to aging and disease. Naturally, we find vitamin E in a variety of foods like nuts, almonds, peanuts, seeds, sunflower seeds, vegetable oils, wheat germ oil, sunflower oil, and leafy green vegetables, spinach, broccoli. It plays a role in immune function, cell signaling, and even healthy skin. However, the benefits derived from food-based vitamin E or low-dose natural supplements can quickly turn into risks when consumed in high doses, especially in its synthetic form. Understanding synthetic versus natural vitamin E, it's important to differentiate between natural and synthetic forms. Natural vitamin E is typically labeled as D-alpha-tocopherol, while synthetic vitamin E is DL-alpha-tocopherol. The DL prefix indicates a synthetic version, which is less bioavailable and may be processed differently by the body, potentially leading to a higher accumulation of unutilized forms. Why high-dose or synthetic vitamin E is problematic for seniors. Exaggerated blood thinning and impaired circulation. While vitamin E does have a mild anticoagulant effect, high doses, particularly those exceeding 400 international units, IU, daily, can significantly amplify this effect. For seniors, this can be particularly dangerous. The blood can become too thin, hindering its ability to clot properly in response to injuries, even minor ones. This excessive thinning can ironically reduce efficient blood flow, especially to the extremities like the legs. Imagine a river that's too fluid. It might flow fast, but it doesn't carry as much. Similarly, overly thinned blood might struggle to deliver oxygen and nutrients effectively to the furthest reaches of the body. This can worsen existing conditions such as peripheral artery disease, PAD, where reduced circulation to the legs is already a major concern, leading to increased leg pain, claudication, and a slower healing process for any leg wounds. Muscle weakness and fatigue. Long-term, high-dose supplementation of vitamin E has been linked to anecdotal reports and some observational studies suggesting muscle weakness and increased fatigue. While the exact mechanisms are not fully elucidated, it's theorized that excessive vitamin E might interfere with the metabolism of other vital nutrients or disrupt cellular energy production processes within muscle cells. For seniors, who often face age-related muscle loss, sarcopenia, and decreased strength, any factor contributing to further muscle weakness can have profound implications. It can impact their ability to perform daily activities, reduce their stability, increase their risk of falls, and severely diminish their overall independence and quality of life. Fatigue can compound these issues, making even simple movements feel like an immense effort. Significantly increased bleeding risk. this is arguably the most critical concern for older adults. High-dose vitamin E acts as a powerful anticoagulant. If seniors are already on prescription blood-thinning medications such as warfarin, Coumadin, clopidogrel, Plavix, or even daily aspirin, the combination with high-dose vitamin E can lead to a dangerously synergistic effect. Their blood can become excessively thin, dramatically increasing the risk of serious, life-threatening bleeding episodes. This includes internal bleeding, e.g., gastrointestinal hemorrhage, bleeding in the brain leading to hemorrhagic stroke, severe nosebleeds, or prolonged bleeding from cuts. The consequences of such events can be catastrophic, leading to permanent disability or even death. This risk underscores the absolute necessity of consulting a healthcare provider before initiating any vitamin E supplementation, especially for those on blood thinners. Key point: while small, appropriate amounts of natural vitamin E from dietary sources or low-dose supplements can be beneficial for its antioxidant properties, the notion that more is better does not apply here. For seniors, high-dose or synthetic vitamin E can be detrimental, potentially leading to ironically damaging effects on muscles and critically reducing blood flow to the legs due to excessive blood thinning and other metabolic interferences. Always prioritize food sources and discuss supplementation with a healthcare professional. 2. Calcium, excess supplementation. Calcium is a fundamental mineral, universally recognized for its indispensable role in building and maintaining strong bones and teeth. It's also crucial for numerous other bodily functions, including nerve signal transmission, muscle contraction, including the heart, and blood clotting. Dairy products, fortified plant-based milks, leafy green vegetables, like kale and broccoli, and certain fish, like sardines with bones, are excellent dietary sources of calcium. Given the prevalence of osteoporosis in older adults, calcium supplementation is widely recommended and adopted. However, the widespread belief that more calcium is always better, particularly when taken as a supplement, has been challenged by growing scientific evidence. When calcium is taken in excess, especially without the crucial cofactors for proper absorption and utilization, it can lead to significant health problems for seniors. Why excess calcium supplementation is problematic for seniors. Disruption of electrolyte balance leading to muscle cramps and stiffness. Calcium plays a critical role in muscle contraction, facilitating the shortening of muscle fibers. However, muscle relaxation relies heavily on other minerals, primarily magnesium and potassium. These three minerals need to be in a delicate balance for optimal nerve and muscle function. When there's an excess of supplemental calcium, it can disrupt this equilibrium. Too much calcium can effectively outcompete or interfere with the absorption and utilization of magnesium and potassium. This imbalance can lead to increased muscle excitability, making muscles prone to spasms, cramps, and general stiffness, particularly in the legs, feet, and calves. Many seniors experience nocturnal leg cramps, and excessive calcium intake, without corresponding magnesium, could be a contributing, yet often overlooked, factor. The discomfort and reduced mobility from chronic cramps can significantly impact their quality of life. Artery hardening, calcification, and reduced blood flow. This is one of the most serious and well-documented risks of excess calcium supplementation, particularly when not properly absorbed or directed. When calcium is consumed in high amounts, especially in the absence of sufficient vitamin D, which helps absorb calcium from the gut into the bloodstream, and vitamin K2, which helps direct calcium into the bones and away from soft tissues like arteries, it can accumulate in the walls of arteries. This process, known as arterial calcification or atherosclerosis, causes the once flexible and elastic blood vessels to become stiff, narrow, and hardened. This significantly reduces their ability to expand and contract, impeding efficient blood flow throughout the body, including to the legs. The consequences can be severe. It can lead to or worsen peripheral artery disease, PAD, causing painful cramping in the legs during exercise, claudication, numbness, and slower wound healing. Furthermore, it increases the risk of serious cardiovascular events such as heart attack and stroke, as the hardened arteries are more prone to plaque buildup and blockage. Joint pain and fatigue from ectopic calcification. The improper deposition of excess calcium isn't confined to arteries. It can also accumulate in other soft tissues and joints, a process known as ectopic calcification. This can contribute to or exacerbate existing joint pain, stiffness, and reduced mobility, particularly in weight-bearing joints like the knees, hips, and ankles. The calcium deposits can act as irritants, leading to inflammation and discomfort, making walking and other leg movements painful. Beyond localized pain, the body's continuous effort to manage and process this excess calcium can place a strain on metabolic pathways, potentially contributing to a general sense of fatigue and low energy levels. This can further reduce a senior's willingness or ability to engage in physical activity, creating a vicious cycle that negatively impacts overall health. Key point: while calcium is undeniably crucial for strong bones and preventing osteoporosis, the common practice among many seniors of indiscriminately oversupplementing calcium can be counterproductive and even dangerous. It's essential to understand that simply taking more calcium does not guarantee stronger bones. The body needs the right cofactors, like vitamin D to absorb it and vitamin K2 to direct it, to utilize it properly. Without this balanced approach, excess calcium can ironically worsen muscle cramps, contribute to the hardening of arteries leading to impaired circulation in the legs, and cause general joint discomfort and fatigue. Prioritize dietary sources of calcium and always consult with a healthcare professional to determine if supplementation is necessary, and if so, at what dosage and with what accompanying nutrients.